brought to you by the Dao Health.
This is Delve, a podcast that endeavours to enlighten and support you in understanding and transforming your own health.
Hello, my name is Elizabeth Cullen and my co-hosts are Clarice Berry and Molly Burton. And together we will be drawing on the Dao Health's signature and unique integrative approach to traditional Chinese medicine.
So take a seat at our table, grab a tea, and let's dive deep into the enduring legacy and evolution of medical practices over time.
This episode of Delve is brought to you by Yes. Yes creates vaginal moisturisers, lubricants and feminine washes that respect the vaginal microbiome. They are certified organic, pH matched and designed to be side effect free with no parabens and no hormones. Yes is recommended by gynaecologists and pelvic physiotherapists worldwide. Available online at yesaustralia.com.au. Yes, making vaginas happy for over 20 years. Thank you so much to Yes for making this episode of Delve possible.
Hello and welcome back for another episode of Delve. I'm joined as always by my lovely co-hosts Liz and Clarice. Hello ladies.
Hi.
Hello.
Nice to be back.
Nice to be back in the studio. On today's episode, we'll be discussing making menopause yours, understanding the transition into menopause. So a really big episode today and something that we're feeling very passionate about unpacking together. So before we dive in, I'd love to hear from you both. What's one thing you think most people misunderstand about the menopause transition?
I think one thing would certainly be underestimating the amount that the brain changes and the toll that that takes on women, how it can affect their day-to-day life. We know that brain structure can change by 30% during menopause.
Yeah, it's huge. It's huge. And I think mine would be, which people are becoming more aware of now, but menopause isn't just a period of time where you're getting hot flushes and your period's becoming erratic. It starts actually a lot earlier than that.
And it's so much more than just hot flushes.
Oh,
absolutely.
Definitely. Alrighty, so to dive into our dynasty subject for our segment for today, we're going to dive into the history about menopause. So in ancient times, cultures like Egypt and Greece had a bit of mysterious view of menopause. Since women could no longer bear children, it was often seen as something troubling or confusing. The term menopause actually comes from the Greek words men, so month, and pausus meaning pause, so meaning the pause of the monthly cycle. However, ancient societies didn't really have a term for this phase, and there were very little understanding of what's going on inside the body. Fast forward to the Middle Ages, where menopause was sometimes considered a curse or even a sign of decline into old age. There wasn't much medical understanding behind menopause, just that it marked the end of a woman's childbearing years. And as you can imagine, this created quite a bit of stigma and fear around the subject, and it was rarely discussed openly. Then in the 19th century, modern medicine started to take a closer look. Doctors began to understand that menopause was tied to the decrease in ovarian function, but it was still viewed as a problem to fix, sometimes with drastic measures like surgery. It wasn't until the 20th century, particularly in the discovery of hormones and hormone replacement therapy, also known as HRT, in the 1960s, that menopause started to be framed in more of a positive light. HRT as a treatment option allowed for a new approach to managing symptoms and made it possible for women to see menopause not as an inevitable decline, but as a manageable life transition. But as we do know, historically with HRT, it did, have a bit of a deeper turn by the 1990s as the Women's Health Initiative study gained prominence. So the WHI was a landmark research initiative aimed at understanding women's health, particularly focusing on effects of hormone replacement therapy. So unfortunately, this all came to light in the media, and the findings in the early 2000s was quite controversial, especially regarding the potential risks of HRT. It also sparked a broader conversation about menopause and women's health. And we will dive a little bit deeper into the findings there and where we are now in 2025. Because I think in terms of HRT, as we now call it MHT, it's come a long way.
Absolutely. A very much needed conversation.
Yeah, definitely. And I think, you know, now moving into 2025, the conversation is growing around menopause, perimenopause, postmenopause. But 97% of our listeners agree that menopause is still not talked about enough in society. Yeah. And that I think something that we really want to highlight today is that it's different for each individual. You know, and the transition through to menopause into postmenopause can be so vast and so different for every individual. And interestingly, when I was researching for this episode, you know, I was trying to find some imagery to represent women going through perimenopause and menopause, but it was really hard to see any real representation of women, you know, from that age bracket of 40 to 60. It was
interesting.
It was either, you know, a woman in her 20s and 30s, really youthful and young and fit, and then otherwise, you know, a woman in their older years with grey hair and that really decline in fragility in their body. Yeah. There's nothing to show in between. And, you know, I think from a media side of things, we are talking about it, but it's probably not in terms of the view of what's perceived as a woman. You know, we're still young. We've still got so much vitality.
Hugely.
And it is almost like it's a time of the invisible woman, because if you're not even able to find images of women at this time, in a period that should be celebrated, many women say it's the best time of their life post-menopause.
Yeah, hugely. And I think honestly it really stems down to like the culture that we're in and trying to be as youthful as possible with, you know, everything going on with everybody using Botox and different things like that. But even women in the media and in Hollywood, you know, in their round table circle conversations they have, women in their 30s are being offered mothering roles or being offered the late mother role. And it's like, unless you're in your early 20s, you're not represented. You're not represented in the media. And I think that stems down all the way to the conversations of everything being hushed and taboo and women feeling like they can't voice, one, the symptoms they're going through, but also how they're feeling with this massive transition happening in their life where they feel like a sense of loss of their identity too.
Yeah, definitely.
Absolutely. And I think they're finding it hard to find ears that will listen.
Yes.
Yeah.
Hugely.
Because we do know that, you know, coming into menopause, it is inevitable. It's going to happen to each and every one of us. And it's a natural, beautiful part of life.
Absolutely.
As we always talk about in traditional Chinese medicine, which we'll get into, is, you know, aging gracefully and utilizing the tools and education around us to work through this transition. You know, we want women to feel empowered. We want to see all representations of women. We want women to feel strong, and we want to embrace these changes that come with becoming a wise woman.
Absolutely.
Beautiful. So let's dive a little bit deeper into menopause. So we did say before that it's a natural part of every woman's life, but it's often shrouded in mystery. Like Clarice was saying, it's often hushed. Let's not talk about it. But, you know, each and every woman's going to go through it. So let's unpack it and see what's actually really happening. So like we said at the start, menopause isn't about just hot flushes. It's a whole body process. So it marks the end of reproductive years, and the average woman in Australia is approximately 51 when she does go through menopause. However, like mentioned at the beginning, it doesn't start there. Like the journey, you know, in terms of perimenopause can last anywhere from 2 to 12 years prior to that final menstrual bleed. Yeah. And during this time, the hormones are shifting, and it's a window of opportunity, as we talk about in clinic, to take charge of your health. Yeah. You know, once again, we meet women at any point of their health journey. So, you know, utilizing the resources around you, and we can take charge so you can really feel better during this time.
And improve how you go through that transition into menopause. And I'm not saying we can magically get rid of your symptoms, but we can decrease the severity of them quite significantly. And it's
timing and frequency.
Definitely.
And I think it comes down to understanding. what is going on in the
Absolutely.
body. Yeah. So we'll break it down further in terms of the phases of menopause, because there actually is 4 different stages. So to start with, in terms of pre-menopause, this often starts in your late 30s or early 40s. You might just start to notice some changes like slightly longer or shorter periods. Your progesterone is decreasing just that little bit. So like we mentioned in previous episodes, progesterone is our beautiful calming hormone that is produced when we ovulate. So as we move through this transition of a woman's life, the hormones will begin to fluctuate and things will begin to change. So as the progesterone begins to decrease just that little bit each month, you may start to experience some fatigue, mood swings, sleep disturbances, and brain fog. So this is the beginning of the transition.
And this is why it's so important to start tracking your cycle well before this time. But if you hadn't already, now, just so you can start to see those slight changes per cycle.
I would say a majority of my patients that are coming to clinic, like beyond their fertility years and conception years, they don't track their cycles. And I'm like, guys, you really need to track your cycles, because it's going to highlight these subtle changes that you might not notice, but they're significant and they're accumulative, and you see that.
I think tracking your cycle is directly associated with either fertility, and if they've come out of those family planning years, like the newer gens who are coming through now, they know to track your cycle for menstrual health. But the gens that are now coming through for premenopause all the way through to menopause, they don't see that connection in general of why you would be actually collecting that data.
Yeah.
And, you know, those patients who've been using like the old school app, you know, My Period Diary or like with the flowers, love it. Whatever you've been using, it's so valuable. If you've got 10 years of data, which some of my patients do, I'm like, this is perfect, because I can see what's been happening with your cycle.
It's amazing.
If you still need to write it down in your paper diary, we love that too, you know, like, you know, whatever we can gauge so that we can see the pattern. So like Liz just mentioned, you know, if it's slightly one day, it does mean, you know, we can start to see what is happening.
Absolutely.
You know, and if we're starting to see more headaches, for example, or you're feeling quite irritable at certain times, this is all information that can help us, help you
100%.
through the transition.
And because they're often in that sandwich age where they still have young children, but they also have parents, no wonder they're not tracking their cycle. I can imagine it's the bottom of their priority list. But this is one thing that they can do for them at the moment, but also for their future selves. Because if a patient comes in and says, look, I've had these flooding periods for the last 6 months, what was your period like beforehand? I can't actually remember.
Yeah.
And understandably so, but that's why let's just keep collecting that data so that we've got it to refer to.
Yeah, definitely.
And then moving through to the second phase, this is the perimenopausal phase, and it's been quite a big topic coming through the years, which is great, because this is the time where we can grab the reins and really support women through this transition phase. So perimenopause can last anywhere from 2 to 10 years.
It's a long
before
time.
the woman officially reaches menopause. So this period is marked by significant hormonal shifts that, you know, can be described as a bit of a roller coaster ride. So what's happening in the body is that we start to produce less progesterone, and our estrogen levels can really start to fluctuate quite widely. So there's a really beautiful diagram which we can add into the show notes, but it shows, you know, the progesterone just cruising along and the estrogen is going widely up and down. So some women can be at the high on certain days, experiencing those really high estrogen symptoms, and then the next day can be quite low, which can then associate, you know, different symptoms like the heat, the vasomotor symptoms that we talk about. So
dryness, big one. Both skin dryness, skin changes, vaginal dryness is a big one.
Definitely.
And not well talked about.
No, and I think patients and women in general in the community can get really confused, because if they're still getting their period every now and then, even though it's changed, but they still have a period, but they have all these other associated symptoms, they don't necessarily think that's the right time to reach out to a doctor because they don't associate it with menopausal symptoms.
Yeah, exactly.
Yeah.
Professor Pryor even describes it as the ovaries grand final or fireworks show. So you can think about
I like that.
a fireworks show that can kind of give you that visual representation of what is happening in the body. So with perimenopause, like we're talking about, it can be at any, 2 to 10 years. So you might have heavier or lighter periods. The hot flushes might start, the night sweats, the brain fog, which we'll get into, the weight gain around the abdomen. The intensity of these symptoms can really pick up around that 45 to 47-ish age as we're moving more towards that later perimenopause into our final bleed. So it's also important that we highlight that while these symptoms can feel overwhelming, they're not uncommon, but there's lots we can do to help support women through this transition phase.
They're not alone.
Yeah, no.
Definitely. And then so it takes me to menopause. So menopause actually is just one day on the calendar. So, a lot of our listeners didn't actually know this one. So when we talk about menopause and we use the term menopause, people think it does govern this whole period that we've just been touching on. But it is actually just one day on the calendar. So, for example, a woman will have a period, say, in May, and then it's not until the next May that she's officially in menopause, because we have to go through a whole 12 months without a menstrual bleed to be officially into menopause.
Or, who said it? Graduated into menopause.
Oh, yes.
Oh, I love that. You have graduated. And I know, and it's so frustrating. I've had a couple of patients come through recently where we're like, yes, we're at month 11.
Yeah.
We're away. And then they'll get another bleed. And I'm like, sorry, we are all the way back to day one. But you know what? I'm like, you've still got some good jing there. Everything's functioning. But for them, they're like, ugh.
But you know how usually leading up to that, they think that it's because they've officially gone into menopause, but it's this nice boost of estrogen that they get again.
Oh,
and it's like, they'll say, for example, if I've seen a patient 2 weeks before they've got that last period, they're like, I feel amazing. I'm like, girlfriend, you are on your way to menopause. This is great. We're so close. And then literally, bang. Period.
Yeah.
But it's like, I always see it as like, a little bit more estrogen's not going to hurt.
We'll take it.
Yeah.
100%.
I think that's something that we highlight in terms of that perimenopausal phase. Let's keep you ovulating. If we can keep you ovulating, you're producing progesterone, which is going to help balance out the wild roller coaster of estrogen as much as possible.
Yeah, exactly.
And support that nice smooth flow into menopause.
Absolutely.
Yeah. And those patients too that are really suffering with those vasomotor symptoms of hot flushes, they'll sometimes just come in and sit down and like, I haven't been taking any of my herbs, but my hot flushes are gone. And I'm like, you're going to get a period soon.
Sorry to say.
Watch this space.
So like I said, it is merely just a day on the calendar. And after years of big hormonal shifts, the estrogen has now reached a lower state, but doesn't go away. It still functions about 10%, which is really important for postmenopausal women because we do know how amazing estrogen is. Also, just a note there as well, if a woman is having a hysterectomy for whatever reason, that's the removal of the uterus and the cervix, depending on the outcome of the individual. We're highlighting to keep your ovaries if you can, and if there's no other health risks that are associated with that, because they still produce some estrogen.
And we
love estrogen.
need it.
And not only from a hormonal perspective, but also for brain health.
Yes, which we are teasing.
And bone.
We are.
Brain and bone.
Yeah. So then we've reached the fourth phase, which is postmenopause. So the final phase encompasses the remainder of a woman's life after menopause. Research from the University of Melbourne, interesting, concluded that majority of the women over 60 report feeling pretty fantastic, while others' observations of women over 70 are likely to be the happiest they've been.
That's amazing.
Yeah.
There is light at the end.
100%.
There is light.
And especially for women who have struggled with their period for years. Now they're in a stage where that's not throwing them around and they're not on that roller coaster. Amazing. Like, this is the feedback that women need to hear.
Definitely.
That there is a light at the end of the tunnel. And after they graduate,
we're here.
I'm going to use that now. I love that. They graduate from menopause onwards and upwards.
Onwards and upwards. Yeah. And like I just said before, because the estrogen is functioning a little bit lower when we have reached the postmenopause phase, it can give rise to fewer more of those urinary symptoms. So things like the vaginal dryness, painful intercourse, incontinence, prolapse, low sexual desire, all these things, which is often not talked about, or women don't know that there's treatment options out there to support you with that.
I'd even say, like almost guarantee that those symptoms are spoken about less than what we're speaking about with menopausal symptoms.
Yeah, I agree.
Because this group of women just get on with it.
Yeah.
Whereas they don't know that there is support available.
Yeah. And even in consult, in a really safe environment where we're really open and supportive, I usually find by like maybe the third or fourth consult, they're like, actually had really bad, terrible vaginal dryness and it's so painful to have intercourse. And I'm like, girlfriend, should have told me that day one. We could have been working on that.
Absolutely.
But I understand. Like you can understand why that's something that they don't feel comfortable talking about. And also they're not sharing that with their partners too because they don't want to, I guess, rock the boat in that sense. But yeah, it's really, really unfortunate.
I think as well, just once again, coming back to, something that we really emphasize at the Dao Health is an integrative team. So, in all phases of a woman's life, having a supportive healthcare team around you is the best thing that you can do for yourself. So especially during this time where it's very uncertain, we don't know why certain symptoms are happening. Liz mentioned before, but the sandwich years, we've got those pressures of elderly parents and then younger children as well. And you're just trying to get by. Plus you have a career, plus you're doing all the other amazing things that you do as a woman.
And managing a house with potentially your life partner, but there's so much on their plates.
Yeah.
And it's just like a tug of war. They're just like this everywhere. So how can they even remember to look after themselves?
And they're looking after everybody else. Yeah.
So coming back to establishing really good relationship with your GP, that's a big thing. We love a good GP.
Hard to find, but
gynecologist if needed, if there's any other factors there for you. But something that most women in this demographic don't realise is the benefits of a women's health physio and an exercise physiologist. So both those modalities alongside acupuncture and us as TCM practitioners work so well for this phase of life for women.
Definitely.
Things like the painful intercourse, things like vaginal dryness, for prolapse, incontinence.
Which, just to take a moment, if there's been any birth trauma or if there's been any pelvic floor damage, but there was no repercussions or symptoms at the time post-birth, because of that lack of estrogen post-menopause, this is a time that prolapse can occur because we've got that downwards actions, whereas estrogen holds and draws upwards.
And same thing for those women who might be experiencing really heavy periods and they're at age, they're not wanting kids anymore. They might actually opt for a hysterectomy and keep the ovaries. But even that change in anatomical structure where the uterus being removed, that's a big proponent where your organs will shift and there will be gaps to feel, which then leads to a bit of heaviness sensation and prolapse as well.
Absolutely.
So I was going to say your pelvic floor physio will just be wonderful to look after you there.
And I think that's the thing with menopause, not only, hot flushes, night sweats, but that major component there of your pelvic floor, which definitely is not spoken about.
And should be looked at preventively. Yes. Like if you know you're going in for a hysterectomy, you need to be working on that before it's even taken out.
Let's get them years and years, decades before, prior to birth, please.
Prior to birth, post-birth, and then continue with your monthly or two-monthly checkups just to see how it's all flowing.
So let's hope with this generation of women that are coming through who are supporting their pelvic floor, aware of their pelvic health through birth, whether that be through a vaginal birth or C-section, that this is going to be a different story for them in the next 20 to 30 years.
Yeah, definitely.
Yeah. And also how we look after ourselves in the postpartum period will set you up for menopause. There's research to show how we look after ourselves, and especially from a Chinese medicine perspective in terms of your kidneys. Kidneys.
Yeah.
This is going to set you up for future years as a woman.
Well, it's a golden opportunity.
Golden opportunity. Yeah. And if you'd like to read more about our golden opportunities, Liz wrote a really good Dao Does journal on the website. So in terms of the brain, we know that, like Liz mentioned before, there's a 30% decline in brain function. And one of the main things that women struggle with during the transition period is the brain fog. That can be described as just not knowing what words annexed
Yeah.
and stumbling, and you know what it is, but you can't get it out,
Absolutely.
can be super
Yeah.
frustrating.
It's awful. And, I've only experienced that from a pregnancy and postpartum perspective. But as a woman who loves to connect with other women and other people through conversation, that's really hard, because then if you can't have
Articulate.
those conversations that are witty and quick, you almost lose a little bit of yourself. So I can only imagine, you're going to get that back when you come out of postpartum. But I can only imagine for women in menopause being in that for a long period of time and needing that connection through conversation. It would be so difficult.
So difficult.
And I think the hardest thing, which we do as women at all stages of our life, but we're always comparing ourselves to our past best self, whatever that might be.
That's a good point.
And I think for women, especially women very highly in the corporate area or really using their brains well, and they've always found their identity in being a very high intellectual, it's a massive rock to their confidence.
Absolutely. And this age is often the peak of their career.
Yep. Exactly. It is so true. And they're like trying to keep on top of everything and juggling these flushes and juggling this dryness and just feeling like they're not themselves. And it's so confusing.
Very
and
confusing.
Yeah, I can understand the stress about it.
But
It's huge.
there's some beautiful, amazing, groundbreaking research coming out of New York City. So Dr. Lisa Mosconi, a neurologist, and her team have been doing some really investigative research into how menopause affects brain function. In fact, she was recently interviewed on one of my favorites, the Diary of a CEO podcast, where she shared some really eye-opening insights and images on the changes of the brain.
That was a great episode.
Yeah, throughout premenopause, perimenopause, and menopause. So I think that's a great one to listen to, just so you can understand a little bit more about the changes.
Can I suggest?
Yeah.
If you are a daughter or a son or a life partner of someone also going through menopause, listen so you can understand what's going on as well, because often there can be a shift. And if you can support your mum or your partner or your friend through this time, it means that they're not alone.
Yeah.
And that you can understand and relate in a way of saying, oh, look, I've had a listen and I've heard that these are some of the symptoms. That must be really tough.
Yeah, definitely.
Yeah.
Definitely. And I think, interestingly enough, that, it was actually in the 1930s that we had this connection with estrogen and progesterone and the brain and that link between the ovaries and what it does for women. So to only affect the reproduction, but we know how crucial it is for brain health, which we've touched on. So thinking about what we can do to support this phase and how we can maximize the estrogen and the progesterone for these women.
Yeah.
So with all this in mind, how can we make menopause yours? So we understand that this period of life can be quite challenging for women, especially being in the sandwich years, as we keep referring to. But I think this is the beautiful thing about traditional Chinese medicine and what we can do in clinic. So traditional Chinese medicine treats menopause as an individual process, so recognizing that no two women are the same. And when we were talking about, different patterns in Chinese medicine diagnosis in previous episodes, it's the same when it comes into treating and supporting menopause. So, one woman will come in for a particular signs and symptoms, but her pattern is going to be different to her friend as well. So thinking about that, because it's no one size fits all approach with traditional Chinese medicine. So TCM tailors treatment to unique body and symptoms.
Yeah.
So when we think about what the mechanism is, and we've talked about the kidneys a lot here, so TCM focuses on the balance of the yin and the yang, the kidney yin and the yang. So this is the central part of reproduction. It supports our vitality, which we love.
Yeah, our kidneys in Chinese medicine are seen as like the genetic material that's passed down from your parents to you, and then you pass on your jing or kidney jing or essence to your children. And the kidney essence grows in abundance when we go through puberty, reaches its peak when we're in our fertile years, and then naturally it will slowly decline as we age. And menopause marks a transition where that kidney yin and kidney yang have both declined, and we see a bit of a firework effect happening where the yang's doing this and the yin's doing this. And if we sort of were to use the terminologies in Western medicine, Kidney yin is very much akin to estrogen. So dryness is a big pattern for a lot of women. And we also associate the kidneys with the ears, the bones, and the hair in Chinese medicine. So we naturally see potentially hearing becoming challenging. Our hair changes colour, and we also have more brittle bones as well.
Knee pain.
And knee pain. Lower back and the knees are associated with the kidneys in Chinese medicine. So we see a lot of that pain come through as well.
And fear from an emotion side of things.
Yeah, the kidneys are associated with the emotion of willpower and with the essence of willpower and the emotion of fear. So a lot of those emotions come up for women in this transition too.
And I think as well, highlighting the heart and the shen in traditional Chinese medicine. So during this phase, we are working with the kidney meridian, but there's that really strong, there is a strong connection with the kidneys and the heart. So utilizing, our acupuncture tool to support the connection once again. And like we keep referring to, the sandwiches can be really taxing on the emotional and physical well-being of a woman. So if we can support her heart, supporting opening up through the chest, we've got a beautiful point through the middle, conception vessel 17, which is a big favorite of ours that we use in conjunction with our other conception vessel points to help strengthen and support the essence and the vitality, but help open up the heart.
Absolutely. And I would like to just take a note when we talk about premenopause and perimenopause. If a woman is already going into that time deficient with qi and blood, and say for that kidney yin, kidney jing, kidney yang have been affected, then they're already on the back foot going into menopause. So I find anecdotally in clinic that if we build that patient up from postpartum onwards into their 30s and 40s, and we really get them into this place of nourishment and really filled and in balance, often their symptoms of menopause, they're still going to be there, like what you were saying, Clarice, but the severity is much less.
Yeah. And we can definitely get in there with a lifestyle advice of those triggers or flares, which we might talk about a little bit. But, those triggers for hot flushes for women, a lot of it can be mitigated by reducing hot things in your diet. So like chili, coffee and caffeine, alcohol's a huge one, which patients really struggle with, because I get it. Everybody likes a wind down.
But honestly, it's a life-changing choice.
It's life-changing, and really there's no benefit to alcohol. No. Aside from the social aspect of it, there's nothing of benefit to that.
But even social element, generalising here, but women socially, they don't need alcohol.
No, they can chat. I mean, we can.
But, like finding like different lifestyle hobbies or habits of how to catch up with your girlfriends.
Yeah, and how to connect.
Just lifestyle changes, which I think we are in general making a really great shift towards drinking mindfully and minimal alcohol. But this group of women, this age group, this is the group that can really benefit.
I actually can't recall the stats specifically, but I remember reading that the likelihood of breast cancer is increased in women who have more, like one beverage a day, than women who are taking MHT or menopausal hormonal therapy, which is just blows my mind.
It was in the M word by Ginny Mansberg.
Yes,
that research.
Yeah.
And I think that's important, because when we come into the clinical space, often we're hearing, frustrations around weight gain and hot flushes and poor sleep quality and mental health. So firstly, thinking about the lifestyle changes that we can make, because there's lots of tools that we can use as practitioners, but I think it comes back to that homework.
Yeah.
Those things like reducing alcohol intake is going to make drastic changes to your sleep quality, your mental health, and also your hot flushes and night sweats. So thinking about that in terms of weight and shifting that stubborn weight, or if your cholesterol levels are spiked up, which isn't a normal thing to happen due to the lack of estrogen, how can we also adapt and support with other avenues like the exercise physiologist to support that resistance training and bone health?
And I think that's the thing, rather than focusing on the weight shift, because we do predict that the body shape will change. Often there will be more weight that will be carried around the abdomen, which obviously can be worked on. on, but there needs to be a level of acceptance of the body's changing without that amount of estrogen. But also let's shift the perspective to let's get you as strong as possible to preserve your bone density.
Yes.
And often a lovely side effect of that would be weight management.
Definitely. And knowing too, I think just practically women who are noticing a change in their body, yes, it's normal, but no, you don't have to continue to feel like you can't control it. Testing your insulin and your thyroid are some big tips there, because women with estrogen declining, which naturally we put on in estrogen dominant areas for women, which is our bust and our arms and our hips and our butt, when we go through menopause and there's a decline in estrogen, there's not a increase in testosterone, there's actually a decrease too. But sometimes that little shift with having a teeny bit more testosterone than estrogen makes you put on male patterned areas of adipose tissue, which is around that abdomen area. And usually with testosterone, there's a big relationship with insulin. And if you can manage your insulin levels, you'll usually be able to manage that weight a little bit easier and make some shifts in your diet, and talk to a great dietitian about that.
Yeah,
definitely. I think that's something just to highlight as well. Once again, coming back to that integrative team is making sure we're investigating the pathology as well. So there's lots of parameters that can be investigated, but strengthened. For example, vitamin D, iron, that can help mitigate the symptoms associated with the transition.
And support women for a long period of time. So again, let's preserve as much kidney gene as possible. And again, from that bone density side of things. Also, we haven't spoken about the connection with the sandwich age side of things, but also a psychologist I think is really important throughout this period of time. Part of the multidisciplinary team, even if it was just someone that you were checking in with every few months, just to hold space for you.
Definitely.
And I was just going to say one tip is like, lighten your load, like slow down, because your body's doing a lot of work. You're basically going through another puberty. It's doing a lot. And I think women do not like that and want to be busier than ever.
And remember, we had this conversation, menopause almost forces you into doing that because it's a time where your load is only increasing, especially if grandchildren have come on to the scene, which is an absolute blessing. But again, another load. But menopause can say, excuse me, knock, 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 you need to listen to your body. And once you start doing that and looking after yourself, quality of life improves.
Definitely.
Become friends with your body. Stop fighting your
think
body.
so too. Reconnect. And that's another thing I was just going to note in terms of open discussions. Have those discussions with your loved ones, like Liz mentioned before, so that people can understand and help you. This is not a transition to go through by yourself.
No.
There's so many tools. There's so many educational platforms. Yes, we're talking about it more, which is great, but let's keep going. Let's, make it not a taboo, because it's not. It's an inevitable process.
Everyone will go
and
through
also
it.
It's an honour to go through that. The fact that our life expectancy as a woman has increased. People in the Middle Ages, no wonder they had such a stigma around menopause. It was so unknown because life expectancy was so low. So we spend half of our lives now postmenopausal. That should be a time that's celebrated. I just want to come back to what you were saying, Molly, from an intimacy perspective around that conversation. This is also an incredible time to consider having a couples counsellor involved as well. Often, sandwich age side of things, it's also a time where you may become empty nesters and you two are rediscovering yourselves again if you're in a relationship. That comes with a whole other layer, plus you getting to know your new body. Often, I suggest that you go and have a chat and bring someone else into that so that they can encourage that communication between the two of you so you can get to know each other again.
And if there's any symptoms that are stopping you from connecting again, whether it's vaginal dryness or painful intercourse, any of those symptoms can be assisted with, things like vaginal estrogen, which you can chat to about your GP, things like traditional Chinese medicine, acupuncture, herbal medicine, supplementation. But just to preface,
and a couples counsellor.
Preface, it's individualized. So please don't go off willy-nilly taking, bits and pieces that you see advertised. Build that team and create that individual treatment plan for you.
Absolutely.
Beautiful. So moving on to our segment of Dear Dolly, so Dear Dao Does. This is where we will answer any burning questions that our listeners may have and unpack them without judgment and, nothing's off limits. we're actually going to twist it up a little bit today.
Oh.
And we're going to be actually unpacking MHT, so menopausal hormonal therapy. So instead of the Dear Dao Does section, it's what should you know? Because I know this is a big topic that we unpack in clinic all the time. There's lots of questions and fears still around it.
Yeah.
But I think it's important that we break it down a little bit more simply.
Cool.
So I've got a little analogy here because I think it's nice to visualize and see, to hear, and so you can understand what's going on. But imagine your body as a garden where estrogen and progesterone are like sunlight and water, helping your plants thrive. So before menopause, your garden is lush and vibrant. Your systems are growing strong and healthy thanks to the steady supply of estrogen and progesterone. As menopause approaches, as we've discussed, the sunlight, which is the estrogen, and the water being the progesterone, start to fade a little bit. So your garden begins to wilt a little bit. You might notice certain plants like your bones or the vaginal tissues aren't as strong as they once were. And this can come with all those myriad of symptoms that can be quite disruptive for your day-to-day. So menopausal hormonal therapy, so MHT, is like installing an irrigation system or adding extra sunlight to your garden. So it helps provide the missing nutrients, so the hormones, and offers your body some extra support, helping it to continue thriving through,
I love that.
through these years. So I think it's important to highlight the bit of the history around MHT. So mentioned earlier, the Women's Health Initiative study in 2002. This is a large-scale study, found that long-term use of combined estrogen and progesterone therapy could increase the risks of heart disease, stroke, and breast cancer. This led to widespread concerns and major decline in the use of MHT, as many women and healthcare providers just feared risks. So it was literally overnight, headlines went out, and it's like, okay, I'm stopping it.
Yeah.
And as you can imagine, that also came with a lot of risks.
Absolutely.
And issues for those particular women that one day were taking their hormones and next day all stopped.
Yeah.
So I think it's important that we highlight, like, where are we now? You know, that's over 20 years ago that study came out, and we've since learned a lot more about MHT. We know that now the formulations are different. The dosages are lower in terms of the hormones that we're using, and they're designed to be gentler on the body.
Yeah.
So we're using bioidentical hormones rather than synthetic. And as I keep highlighting, it's individualized to each woman. It's generally safer for women in their 40s to 50s and during the first 10 years after menopause. So interestingly, something that came out of that 2002 study is they were, utilizing HRT on women that were much older.
Postmenopause.
Yeah, exactly right. And we need these hormones during that transition phase to help the roller coaster of estrogen and to help stabilize the hormones as much as possible. Like I said before, adding that irrigation system in to help just the deficiencies that may be arising. So
on that, Molly, just to delve a little bit deeper, is that the group that were used for the research was incorrect from the 2002 Women's Health Initiative because they were older.
Yeah, exactly right.
So just to clarify that, because I think that's really important, that information that came out that has caused so much damage.
And so much fear.
Actually wasn't correct. And you've still got GPs now who still won't recommend MHT.
Yeah.
And, like, just mentioned, MHT, it can offer relief, but it doesn't replace the lifestyle pillars that we were touching so heavily on before. It's important that we maintain diet, exercise, central nervous system support, sleep, all the things alongside your MHT. And just to note on this as well, we can utilize acupuncture and Chinese medicine alongside a woman that is engaging in MHT use.
Which means they can decrease the dose of MHT and increase dose of acupuncture.
Yeah. So,
and also for those women who don't want to use MHT for whatever reason, acupuncture and Chinese herbs in particular are fantastic at helping to boost up your body's qi and your blood, and also a little bit more estrogen into your system just to help mitigate some of those symptoms.
While we're on that, let's just talk about a clinical reality of what using acupuncture and Chinese herbs looks like. Because again, as we spoke about in the endometriosis episode, you can't just commit to 2 sessions of acupuncture and expect that was going to be able to reduce symptoms that you're experiencing.
Yeah.
Who would like to jump into that timeline?
Yeah, and again, it comes down to, this is the busiest period in your life. It comes down to what you can manage to come into. But usually I would advise my patients who are having huge, significant flare-ups in their symptoms to bring those appointments weekly and continue weekly until we get on top of them. Then that would mean spacing them out to the fortnightly interval, then monthly. And then for some of those patients who maybe they've gone through perimenopause or in the menopause phase and they're coming in for maintenance, they might come in every couple of months, but I want to keep that interval the same. Whatever interval we choose, keep it consistent. And if you have another flare-up, then you need to bring those treatments back together nice and close.
When the summer season arrives and it's muggy and hot and it's aggravating your hot flushes.
Yeah. And also with the muggy season too, like we see a lot of surge in osteoarthritis and arthritic conditions with the swelling and the heat. A lot of joint pain increases around that time.
Yeah. And between our acupuncture treatments, we can utilize Chinese herbal medicine daily, you know, to help alongside your lifestyle parameters to help, you know, in terms of the transition period. Because like we said before, in terms of if you're someone that is going through the transition for up to 10 years, it's a big commitment. But I think also, like I said as well, you know, taking the reins on your health during this time, it can be so, you know, influential for the rest of your life. Because like Liz mentioned, you know, we've got a half of a life, you know, to live. So let's really hold on to that.
And just to clarify with Chinese herbs as well, it doesn't mean that you're going to be on Chinese herbs for a long period of time. It may be that you do a 3-month stint, have a break, and then come back onto them. Different herbal formulas for different individuals.
Definitely.
So again, we would not recommend using Chinese herbs that are off the counter at a health food shop.
No.
Come and see a women's health trained acupuncturist and Chinese herbalist who can prescribe those appropriately for you.
I also just wanted to touch base too on the reality of women who are very much post-menopause now. They've been on, maybe they have the Mirena inserted, they've had it in there for many years, they've been on MHT for many years. How then do these women transition off MHT? Because I think they're so fearful of doing it for fear of all their symptoms coming back with vengeance. How would you word that with your patients and how do you like to attack that?
Great question. I'd be planting the seed of let's consider a time in the next year or two. Obviously, I'd like to see it sooner rather than later, but what's going on in their life, if they've got a child that's getting married or whatever it may be, they're like, I can't even think about that. No worries. Let's pause that and let's plant the seed for next year. Depending on who has prescribed them the contraception or MHT, let's get back in touch with them. Prior to coming off, let's get all your bloods done. So let's make sure you're in optimal range and again, plentiful.
Yes.
And then prior to coming off, just like what you do with the patient coming off the pill. I want to see you weekly from 3 months prior.
And we can then mitigate and
build you up, build you up. Throughout that period, if we've got a year to work on it, let's get the exercise physiologist involved. If there's any pelvic floor issues, let's get those sorted now as well so that you've got your team around you. Once you come off that medication or contraception, we're here to pick you up.
Yeah, definitely. I think that ties really well into, you know, coming to the end of our episode and the action steps that you can take away from today's discussion. You know, we keep highlighting, but every woman's experience is different with menopause and what works for you might not necessarily work for someone else. And it's essential that we build that team around us. There's some really good resources out there from Dr. Lisa Mosconi, which I mentioned earlier in her episode with Stephen Bartlett on the Diary of a CEO. Amazing. He also did an amazing episode with Dr. Mary Claire Harbour out of the States. So there's some really great episodes there to have a listen to understand a little bit more about the transition so you can understand what's going on with your symptoms and then build your team around you to help support the best way through this transitional period.
Yeah, amazing.
Beautiful.
Also, Jean Hales. Jean Hales has an incredible wealth of resources for women for many seasons of their life, but I think that's really good accessible information too. And The M Word by Ginny Mansberg, I really enjoyed that book.
Yeah. And Sober Curious, which I know is one of your favourite.
I love Sober Curious. And again, it's not about becoming sober. I know that can feel really final, but it's talking about how can we be minimally drinking mindfully. And that book is really great to build that relationship or to rebuild that relationship with alcohol.
Yeah.
Yeah.
My just quick tips would be just talk to your girlfriends and also ask if your mother's still with you. Ask your mum, when did you go through menopause,
That's very
Mum?
important.
When did you go through menopause?
How was that?
Yeah, and how was your transition? Because it's very likely that you're going to go through a very similar experience around the similar age, which then allows us to pre-plan, prepare your body. So,
And if you've got older sisters as well.
Yes. Yeah.
Beautiful. Lovely. Well, that's another episode of the Delve podcast by the Dao Health. Thank you for listening. Thank you to my lovely co-hosts.
Yeah.
And if you're listening from somewhere afar, whether that's overseas, we'd love to see. So please tag us in your socials and we'll see you at our next episode. Bye.
Bye.
Thank you for listening to this week's episode of Delve and being a part of our community. Follow @TheDao on Instagram to vote in our polls and stay connected. Ask our team a Dear Dao Does question via the link in our show notes. And for more information and to sign up to our newsletter, visit our website.
The content provided on this podcast is for informational and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition.
Leaving a review on Delve helps others to find our show and increases awareness for women's health and traditional Chinese medicine. We would love if you can take a moment to like, subscribe, and share. This episode was recorded on Gadigal land. Always was, always will be traditional Aboriginal land.